Hi, I'm Jasmine Frost, and today I will be informing you of anxiety disorder and its effects. According to Dirk Adolf and colleagues, authors of the article German Anxiety Barometer Clinical and Everyday Life Anxieties in the General Population, in both poor and rich countries, anxiety disorders are a major cause of disease induced stress, ranking even higher than widely recognized as widespread diseases such as diabetes, chronic lung diseases, or arthrosis. Maybe you are a housewife or a house husband, or currently unemployed, or from a lower socioeconomic status. Studies have shown these are some of the identifying factors that are most associated with anxiety disorders. Likewise, women are more likely than men to be diagnosed with anxiety. Working as a habilitation technician and qualified mental health professional, I have a vast amount of experience with individuals experiencing high levels of anxiety and have witnessed the detrimental effects firsthand. Anxiety disorders are among the most common mental disorders. The chronic nature of anxiety can lead to serious implications on an individual's quality of life if not properly identified and treated. To fully comprehend the chronic nature of anxiety disorders and how it significantly affects a person's life, one must first define anxiety and identify signs and symptoms. According to the psychologist Dr. Britt Klein and colleagues, authors of the article Anxiety Online, a virtual clinic, preliminary outcomes following completion of the 5 fully automated treatment programs for anxiety disorders and symptoms. Anxiety disorder is a generic term given to a group of specific disorders that are typically characterized by fear, worry, and phobic responses. There are 5 specific subcategories in which anxiety disorders are subgrouped, according to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition. Generalized anxiety disorder, or GAD, panic disorder, or PDA. Panic disorder can be accompanied by agoraphobia, which is the fear of places or different situations. Obsessive compulsive disorder, known as OCD, post-traumatic stress disorder, or PTSD, social anxiety disorder, known as SAD or SAD. According to Dr. Peter Roy Baum, author of Treatment Refractory Anxiety, Definition, Risk Factors, and Treatment Challenges, anxiety can be defined as distressing psychological as well as psychosocial experiences that are then reported to the individual's healthcare provider. The psychological symptoms associated with anxiety are also present in other psychiatric disorders. Anxiety symptomology is seen in broad spectrum disorders like autism. Anxiety is seen in bipolar disorder during manic and depressive phases. Anxiety can be present during conditions of intoxication or withdrawal in individuals with substance abuse disorders. The high prevalence of anxiety disorders and subsequent healthcare policy implications are being witnessed not only in the U.S. but worldwide. As Olivia Reams and colleagues said in the article, a systematic review of reviews on the prevalence of anxiety disorders in adult populations. In the United States, about 18% of the total population have reported anxiety disorders. Anxiety disorders have contributed majorly to healthcare costs. In 1999, the annual reported cost associated with anxiety disorder reached a whopping $42.3 billion. As stated by Dirk Adolf and colleagues, authors of German Anxiety Barometer, Clinical and Everyday Life Anxieties in the General Population, in Europe, their point prevalence is about 10%, 1-year prevalence is 14%, and lifetime prevalence of anxiety up to 29%. Globally, high levels of anxiety are frequently associated with highly industrialized countries, as well as countries with increased political upheaval. The detrimental effects of anxiety have various psychosocial consequences. According to Dirk Adolf and colleagues, author of German Anxiety Barometer, Clinical and Everyday Life Anxieties in General Population, anxiety can develop as early as adolescence and progressively become chronic, leading to serious implications on the individual. Epidemiological studies have suggested that individuals suffering from anxiety disorders have significant distress and subjective suffering, increased negative performance at work, as well as increased comorbidity. Longitudinal studies have suggested the presence of anxiety disorders increases the likelihood of development of other mental health diagnoses later in life. Anxiety is linked to both depression and substance use disorders. According to Olivia Reams and colleagues, authors of the article, A Systemic Review of Reviews of the Prevalence of Anxiety Disorders in Adult Populations, the Global Burden of Disease study estimated that anxiety disorders contributed to 26.8 million disability-adjusted life years in 2010. Although there are several debilitating effects to individuals suffering with anxiety disorders, treatment rates are still relatively low. According to Dirk Aldoff and colleagues, authors of the article, German Anxiety Barometer, Clinical and Everyday Life Anxieties in General Population, despite the massive prevalent rates of anxiety disorder, treatment rates are only between 40 to 50%. Various attitudes, preferences, and belief systems have affected treatment outcomes and adherence to treatment for anxiety disorders. According to Dirk Aldoff, normalizing attitudes which interpret symptoms as a normal and expected consequence of stress, panic and GAD, personality or SAD, SAD, and trauma, PTSD, may account for finding that anxious patients are much less likely to perceive a need for treatment. Patients may have experienced adverse side effects or medication ineffectiveness contributed to non-adherence. Disbelief in the effectiveness and the choice of treatment recommended by the healthcare provider. As stated by Dr. Britt Klein and colleagues, authors of Anxiety Online, a virtual clinic, preliminary outcomes following completion of 5 fully automated treatment programs for anxiety disorders and symptoms. In the Australian National Mental Health Survey, only around 1/3 of those with an anxiety disorder, 37.8%, reported making use of services over the previous 12 months for their mental health problems. In conclusion, anxiety is defined as a profuse worry, fear, as well as phobic responses and increased stress. This disorder can exude a chronic nature. The reported occurrence of clinically significant anxiety and cost on the individual and society have risen dramatically in the United States and worldwide. The psychosocial effects of anxiety include decreased productivity in work and personal relationships, debilitating subjective stress and suffering, and comorbidity. Although the presence of anxiety disorders is increasing, treatment for these disorders have been negatively affected by various social and cultural preferences. Thank you.